Hello. Welcome back to the Matriarchy. This is Lisa, and I'm here with Kath. And today we
Hello.
have another fantastic guest, and that we're so proud to bring on to talk to her about her work. She is Dr. Karen Sheffield Abdullah. And I am going to pass the mic, so to speak, over to Kath to give a full introduction for Dr. Karen.
Yeah, it is my pleasure. And when Lisa and I first started, coming up with some topics that we wanted to talk about, maternal health and specifically how women of color are impacted was one of them. So we are delighted to have Dr. Karen on our show. Dr. Karen Sheffield Abdullah is an assistant professor, certified nurse midwife, mindfulness coach, and researcher whose work centers on perinatal mental health and health equity. She studies how stress, anxiety, trauma, and structural factors shape pregnancy and postpartum outcomes, and she develops culturally relevant interventions that improve care for all mothers. Her expertise has been featured on outlets such as the New York Times, Politico, TEDx Talks, and NPR. Karen is a co-investigator for Mom Genes, a research study advancing precision approaches to postpartum depression. Welcome, Dr. Karen.
Welcome.
You. Thank you. It's a pleasure to be here. Whenever I listen to that introduction, I'm like, yeah, those are the things that I'm passionate about. So I'm happy to talk to you today about Black perinatal mental health, Black maternal health, maternal morbidity, mortality, really what is kind of important at this juncture, at this time that we find ourselves in 2026, and whatever else you guys would like to talk about. So thank you for
Well,
having me.
yeah, let's start at the beginning. This work feels so deeply personal. So, who are the women who shaped your understanding of strength, care, and motherhood? And how did you find your own voice?
Yeah, yeah. So, yeah, so I have to say my mom. It really, my mom was the pillar of strength, an amazing woman, somebody who um, has absolutely shaped who I am and how I show up in the world, and a little bit of my fierceness, and my strength for sure. And really, the best way to get me to do something is to tell me I can't do it. So um, she is a person who had high school, nothing but a high school degree, high school diploma, and came here from Jamaica, and started life here, and made a very comfortable middle class life for my family and I. And just to see how she worked through life's struggles was pretty amazing to watch. And there are things that I have a better understanding of now, being an adult, of how much she sacrificed for me. And I'm really, really just amazed at how courageous and selfless she was. And she unfortunately passed away in 2021 from a rare non-small cell carcinoma, lung cancer. She was never a smoker, and just to even see her strength through her transition, right, through her reconciling her own mortality, and me, as you mentioned, I'm a midwife, but me midwifing her through that transition, right? So being with her and at her side during that time, just an amazing, amazing, amazing person. And I think about her every single day. And so that's where it all started. She really had a no nonsense attitude. Both my father, um, and my mom had a very strong emphasis on education. So I ended up going to boarding school at the age of 13 because it was what
Oh.
all the folks in the Jamaican community were doing, was sending their
Mm.
children to this boarding school in Connecticut. And so I've been out of the house since I was 13, and then I went on to get a physics degree in college. I got a bachelor's of arts in physics, not because I was interested in physics, but it was what my mother and my father said, that's what you should do, science and math. And so I did science and math. I minored in math, majored in physics, and then went on um, as a second career to become a nurse and a nurse midwife. And
Oh,
so
interesting.
um, really, she has shaped who I am today. And I think more deeply about my research and how I've landed where I've landed in terms of the work that I do, seeing what I've seen across the 20 years that I've been a nurse midwife, right? And having my finger on the pulse of what has been important to my patients and really listening to what they have to say. I knew I was really interested in mental health because, in full disclosure, I'm somebody who has coped with anxiety across my entire life, and stress and what we call kind of cumulative stress, weathering across the life course, if you will.
Mm.
And so I think we study depression quite a bit. I don't think we study anxiety nearly enough. And so, especially
Oh.
within the Black community, what does anxiety look like for Black women? How do we talk
Mhm.
about it? Do we talk about it differently than the global minority? You know, what is here for us? And so I knew I wanted to study mental health. And really, when we think about it in terms of maternal outcomes, we know that stress and anxiety are key contributors to preterm birth, and they're key
Mm.
contributors to low birth
Interesting.
weight. And so if we can think about a way,
Interesting.
other than medication, not that medication is bad, but just thinking
Mhm.
about non-pharmacological ways of
Mhm.
managing our stress and anxiety during pregnancy, is
Yeah.
it possible that we could change the trajectory or lower the rates of preterm birth and low birth weight in that particular population? And so
Mm.
that's how I landed there. I'm really passionate about it. And then also I'm a mindfulness instructor, as you mentioned in the intro. And so really thinking about culturally relevant, trauma responsive, person centered mindfulness that really sees the individual at the core of their what resonates culturally for them,
Mhm.
right? And thinking about the ways in which that could be incorporated to impact mental health as well. So I'll stop there because that was a long-winded.
Very interesting. So you mentioned your research studies. I know we definitely want to talk about this. Can you tell us about mom genes and what that study is looking at, and then also, um, where it's at and where it's going?
Yeah, thank you. Thank you for that opportunity. Just to quickly mention, Mom Gene Study is where people can go to find out more about this particular study, but it is led by Jerry Quintavano. He is the principal investigator. It's an NIH funded study through the National Institutes of Mental Health.
Okay.
And basically, he's really interested in understanding more about the genetics of postpartum depression specifically. So anybody who has had a child can be in this study. If you're 45, if you're 50, if you're a grandmother, like you can be in the study if you have had a baby before. Um,
Okay.
and the reason why we're really interested in looking at this is we don't know that much about the genetics of postpartum depression. And historically, postpartum depression has been studied in people of European ancestry, but not so much in Black and Brown communities, so Black and Latina women. So we're really wanting to make sure that we get the word out, especially for those communities to be involved in the study. Because we want to gather more information and we protect your information. We're ethically bound to protecting your information. So whatever information we get, we don't share it with like the NIH or other people. Your data is protected, but we're really interested in understanding a little bit more about the genetics behind postpartum depression. I think to some extent anxiety as well. I'm part of the team, so they know I'm going to be interested learning more about the anxiety component.
Yeah.
But what I also want to mention is that they're often comorbid or live together, right? Many people
Sure.
Right.
who are depressed are anxious, right? But
Yes.
not everybody who's anxious is depressed.
That's
Some
interesting.
Really?
people are just anxious. Yeah,
Yeah.
absolutely.
Yeah.
Absolutely. So
Huh.
thinking about that in that way, but yeah, to get more information about the study, there's 2 components to it. You just do a survey, and then there's a blood draw that we have you do. So there's 2 pieces, and then you're compensated for it.
Oh,
Oh, that's
okay.
interesting. And
Yeah.
so having like grandmas in there, like how does that help shape the study?
Yeah, so that's a Jerry question because he is the one who put
Ask
together.
Jerry for us.
Yeah, we can ask Jerry. He would love to actually talk about this. He
Yeah.
loves to understand the genetic component, but the thinking about genetic material and how it's carried throughout the line of from baby to mom to grandmom, right? This kind of
Mhm.
matrilineal lineage, if you will, and trying to understand the genetics of that. I think the idea is that we just want to make sure that people understand that it doesn't matter how far from delivery you are. We're interested in talking to you if
Mhm.
you've had a
Interesting. Okay.
baby.
Mhm.
Well, I'm glad we're having the conversation about postpartum depression. I had my oldest back in 2003,
Mm,
and this was not a conversation. I remember it came like in pop culture, and I was just reading up on it in preparation for this interview. The whole Tom Cruise, Brooke Shields, 2005. Do you remember when Brooke Shields was talking about postpartum depression? And
mm. No, I didn't. It's not necessarily top of mind, but I definitely know that there are those that are in mainstream media who have talked about it, like Serena Williams, right?
yeah,
Like Allison Felix. So I know that there are mainstream folks who have definitely talked about their experiences with postpartum depression. Yeah.
well, I'm glad it's more part of the conversation now because when I first had my kid, I didn't even know that was a thing. And having a baby is hard. And I know you do a lot of work with postpartum, but I want to back up a little bit, if that's okay, and talk about the context of postpartum and going back to, you know, pregnancy. So the United States is one of the most resourced countries in the world, and yet we lead high income nations in maternal deaths. Black women are dying at rates that are 3 or even 4 times higher than white women. There was the recent death of Janelle Green Smith, who I think brings this. She was a midwife who dedicated her life to helping other women give birth safely, and yet she died from complications delivering her own child. So, why is this still happening in 2006?
That's such a good question. I ask myself that all the time, which is part of the reason why I do this research, because I'm like, so what are we missing?
Huh.
Mm,
What are we not getting why this has persisted? Because this has persisted for decades.
Huh.
And yes, Black women are dying at 3 to 4 times the rate of white women, but depending on where you look, that number can be even higher. There are parts of New
uh-huh.
York where it's 11 times
Jesus.
the rate of white women. So really thinking about what is it that we are missing or not looking at more in depth that continues to allow or this perpetuates it continues to happen. um and my hypothesis, the work that I really think about is stress,
Mhm.
and cumulative stress and weathering. Weathering is a type of stress that was coined or developed by Arlene Geronimus, and basically was saying she was saying that Black women experience stressors across their life course that kind of wear us down over time,
Mm,
and that wearing down, that wear and tear makes us more susceptible to poor outcomes, right? So or cumulative stress, stressor after stressor after stressor, or allostatic load by Bruce McEwen, which is again like just putting one thing on top of the other, right? So when we think about stressors, how it is borne out in the literature is it is well known that Black women have a disproportionate amount of stress compared to white women. And so, how are we processing that stress? And how is it showing up physiologically in the body? What's
Mhm.
going on with what I call stress biomarkers, right? So we all think of really quickly like something like cortisol, right, as a stress marker, right? When we get stressed, cortisol levels go up. But there are other biomarkers in the body that indicate that turn on with increased stress. So what's very interesting is that a PhD prepared Black woman will have a worse outcome than an eighth grade educated white woman. And so
Wow.
education and socioeconomic status are not protective. You would think,
Mhm.
well, because look at the person that you just mentioned, right? Dr. Smith.
Yeah.
She's well educated. She has a doctorate. She has a doctorate in nursing practice. You would think that she's highly resourced, and yet that outcome happened.
Yeah.
What is it that we're missing? That there's that type of what we call disparity or health inequity,
Yeah.
right?
I
This
I
inequitable outcome.
I found it, like, when again, in doing a little bit of the research, and I wonder if you could talk about this too, is like Black mothers who are teenagers actually have better outcomes than women in their 20s. And the reason this article surmised was because it was that much more cumulative effect of this of weathering.
So the study that you saw said that Black women who were younger have better outcomes than Black women who are in their 20s?
Their 20s.
Okay, not better
So
than white
it's
women in their
no,
20s.
no, 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 not white women in their 20s, but
Yeah,
Black
so
women in their teens versus in their 20s, which kind of blew my mind, right?
yeah,
I mean, I get that teens are physically, in maybe better shape,
more resilient, yeah.
but the context of being a teenager, having a baby, and having a better outcome than being a woman in your 20s, I found really shocking.
Yeah, yeah, and I've heard that as well. Part of what I've also heard is Black women should try and have children earlier, like sooner, because these outcomes are better when we're younger. But we don't necessarily always do that, right? Like people have careers or things that they want to do, and so they may be having children later in life, and it increases the chances of these poorer outcomes. But I think it's exactly what you said: this cumulative stress that starts to build up over time that wears down our nervous system, our body, what we call our telomeres. So I don't wanna get too technical here, but telomeres are like little
Yeah.
little ends of the DNA, and when those get shortened, it prematurely ages us. And so it has been
Mhm.
found that Black women's telomeres are shorter,
Wow.
because we have been stressed the heck out, right? So and the stress
Yeah.
can be race-related stress, gender-related stress, but when we look at the intersections of gendered racism, it really is compounded in how we show up in the world and how we show up in the healthcare system, which we have a very big mistrust and distrust of based on the historical record. And we can certainly talk a little bit about the history of why there's such a mistrust and distrust by the Black community, and in particular, Black women, as it pertains to feeling comfortable showing up to our appointments and being vulnerable enough to share with our healthcare providers what's going on for us.
Yeah. I I would like to dig into that a little bit more if we could, because I think this is a area that overall just isn't discussed enough. I think just recently, only because of social media, honestly, that we're starting to get an understanding of that disparity. So, yeah, can you tell us a little bit more about it in terms of like your personal experience and the people around you? What their personal experience, and so what breeds that mistrust?
Yeah, so if we want to look at the historical record of what has happened historically for why there's such mistrust and distrust of the medical community for Black people, or Black communities, we just need to look at things like the Tuskegee Airmen study, right, where they gave Black men syphilis and then tested that on them to see how they did
Yeah.
and what their outcomes are. We can think about J. Marion Sims. He's thought to be like the grandfather, if you will, of OBGYN. He is known to have tested or done surgeries repairing what we call fistulas in the vaginal area on Black women without
Mm.
anesthesia.
Oh, jeez.
So
I heard about that.
there's that history. And
Yeah.
then we have Henrietta Lacks, right? So
Big one.
Henrietta Lacks had cervical cancer. We took her cells from her cervix, and for whatever reason, it's known as an immortal line. Like they just kept reproducing, reproducing, and that we know them now as HeLa cells, Henrietta Lacks cells, right? That we still use to this day. But we took her genetic material and learned about this immortal cell line, but never told her family. And this is
Or gave her, or her family wound up still in poverty, and people were making millions and probably billions over this.
on this, right? And then this was fairly recent. I would say probably well into the 1990s that we were. I think her family was still trying to get some type of reparations or acknowledgement of what had been done. So,
Yeah.
thinking about Henrietta Lacks, Tuskegee Airmen, and things like that have definitely caused Black women to be a little bit like, I don't know how much I want to share with people. And then also, what I will say from my studies that I've done is that Black women will say, "Well, I don't want to say that I'm stressed or that I have some type of mental health concern because I don't want CPS to be involved or at delivery when I have my baby, and then they want to take my baby away from me."
Interesting.
Right? So they're worried about and that's born in truth as well. That has happened,
Yeah.
right? Where people have shared something, been vulnerable about something, and then there's a social work consult. The person's not told about it, and then CPS is there at delivery, and the mom had no idea that this was going to be happening, right? So there's this mistrust, distrust there as well. So, and as far as you asked about my own personal life or people that I know, for sure, as a PhD prepared Black woman who is highly educated and highly resourced, I have had to advocate a lot for myself as I have navigated my own health
I can
issues.
imagine.
It's ridiculous how much I have
Yes.
to advocate.
Yes.
Mm.
And only once I tell people what I do or who I am, right? Then all of a sudden it's like, "Oh, you have a medical background."
Oh, wow.
If
Mm.
I say, "Oh, I'm a nurse midwife," then all of a sudden they're having a different
Wow.
conversation with me.
Mm.
So, it's really interesting to watch how they view me when I just come in like my sweats and I'm coming in for an appointment versus once they realize who I am and that I'm educated and that I'm going to call them out. Call them out or call them in, depends on how you look at it. I have a colleague who's like, "Call
Yeah.
me in," call me in where I'm
Yeah.
at. So, for sure, and then, quite honestly, with my own parents, the care that I saw that they received was abysmal in their end of
Mm.
life time, and I fiercely, fiercely advocated for them, which they knew I would. They knew I would. So for my father, I was at his bedside in the neuro ICU. He had a brain tumor, and I advocated for him as much as I could. They put him in restraints.
Mm.
I was undoing the restraints after they did the restraints. I was taking his hands out, like so. Just thinking about, oh, there is somebody on Medicare, an 81-year-old Black man on Medicare. So they're just treating them any type of way. And then they're like, who is this daughter in the corner sitting in the recliner asking every single question of everybody who's coming out? And I went to rounds and I made my voice known and I let them know that I had medical proxy and that I was making the decisions regarding his status. And so I've seen it firsthand. And with my mom, when she was on hospice, I was like, "Where's the hospice nurse?" Because I'm essentially the hospice nurse. Once they
Mm.
knew I was a nurse,
Oh,
they
wow.
were like, "Draw all that up, put this, just do
Oh,
this."
wow.
And so I gave her all her doses, all her medications, and I was just like, Something not right
Yeah.
with this." I don't think, because I was never allowed to be
Yeah.
daughter,
Mm.
right? I was in my clinical role the entire time
Which
with her,
is which
taking
is
care of
too
her. So
much
I've
stress. Talk
definitely
about
seen
stress. That's too much stress.
Yeah.
Oh,
Yeah,
yes,
One of the
that's
many
right?
examples,
Right?
right? Wow.
Yeah.
Yeah.
and there's like an implicit bias, right? An unconscious bias for even like well-meaning
Well-intentioned.
staff, like well-intentioned medical professionals that, can you talk to us a little bit more about that? And I'm struck by like the megastar like Serena Williams, right?
Mhm.
And she wasn't listened to. So she's not listened to, and Dr. Karen's not listened to until you say, "No, I have a background in medicine." How is this playing out in the
Right.
general community?
Yeah, and especially with Serena Williams, because she had a history of a blood clot to begin with, right? So she knew something wasn't right, and she was telling them, and they just weren't listening. She's like, "So when are you
Mm,
gonna start whatever, like my heparin drip or whatever? When are you gonna start that? When are you gonna start that?" And they weren't listening. They weren't listening, right? So we all have biases. We all have assumptions. So oftentimes when I give a talk somewhere, I tell people, don't say you don't have any biases or assumptions, because we all
Yeah.
have them. I have them, right?
sure.
Um,
Yeah.
when I walk in with a patient, I automatically have biases and
Yeah.
assumptions. I just check them. I just recognize, Karen, you have some biases here. Just recognize that, right? Being honest with
Right.
myself. Um, but I do think that there are a lot of very well-intentioned healthcare providers out there who don't necessarily know the difference or don't know the historical record, that need to be educated, or trained. And I will say honestly that there's literature out there that says that medical students, residents, they're not being trained in perinatal mental health.
Mm.
They get like a little blurb, a little blip, and then they're moving on to the next thing. They don't know how to sit with what may be uncomfortable when somebody is
Yeah.
divulging a mental health concern to you, or what to do with that, or what resources they need to be
Yeah.
referred
Yeah.
to. And so there's a lot more that we can do with our learners, whether it's at the nursing level or at the physician level, where we can spend some time talking to them about providing culturally humble care.
Mm.
Yeah. And there was a story that I read that you had this conversation doing rounds, and then can you tell us about that?
Yeah, yeah, thank you for that. So I often talk about Serena Williams and the fact that, she was advocating for herself, wasn't listened to, did end up having a blood clot. It turned into an emergency. They took her back for surgery, and, all is well now. But what I was mentioning is the importance of recognizing that Black women can, not all, but many can show up kind of stoic. And what I was talking about was superwoman schema. So superwoman schema is this conceptual framework that I utilize in my research, developed by Dr. Cheryl Woods Giscombe, who was my dissertation chair and a colleague and a friend. And it basically states that there are certain socio-historical and cultural events that have happened in this country at the intersections of race and gender that have caused many Black women to take on 5 hallmark characteristics. They are emotional suppression, maintaining a stoic exterior, resistance to being vulnerable, determination to succeed despite limited resources, and helping others even at the detriment of our own
Mm.
health.
Mm.
So what happens is oftentimes Black women may have something going on. Oh, it might be a little light headache. I'm all right.
Mm.
I'm all right. Yeah, I don't have time. I got things to do, right? Or eye twitching, or a little bit of chest heaviness, and I'm okay. I'm okay. And they've talked themselves out of going to their healthcare provider. What I had shared at that OBGYN rounds was, when a Black woman says to you that something is not right, believe
Mhm.
them. because what it took for them to get to that place to share that with you is a lot, because they probably tried to talk themselves out of it 10 times before they
Interesting.
actually got to
Yeah.
you. And so, what ended up happening is I gave that grand rounds, and then the next week, one of the physicians who was there said, "If we can just get this message back to Dr. Sheffield Abdullah, could you please let her know that I have changed my practice as a result of what she shared in grand rounds?" And I had a Black woman come in to see me this week, and she was kind of complaining about calf pain, but saying it wasn't that bad. It wasn't that bad.
Downplaying it.
Yeah, downplaying, right, downplaying this calf pain, and she said, "And I remembered the story of Serena Williams, and I remembered that Dr. Karen had said, 'Believe Black women when they say something isn't right.'" And even though it wasn't highly suspicious for a blood clot, she went ahead and did the tests
Mm.
for it. She did what we call Dopplers or an ultrasound to look for it, and that woman did indeed
Oh,
have a blood
wow.
clot. And she was like, somebody's life was potentially saved by the fact that I listened to my gut based on what I learned from Dr.
Mhm.
Sheffield Abdullah about how Black women present and how they may
Mhm.
downplay that because of that stoic exterior,
Yeah.
right?
So that's
So,
really interesting. I can't help but take this full circle back to the maternal outcomes, and if that isn't part of it, right? If the Black women are reluctant to share their symptoms for all these reasons, and they're very good reasons, could that be a part of it? And has that been looked at?
I think it's a part of it, and I also think that when they do say something is wrong, they're not listened
Right.
to.
Right. That's the
Right?
second
So
piece. Yeah.
this physician is saying, "I changed my practice based on what Dr. Karen said," which means more than likely, she would have just dismissed it because the person was just like, "Oh, it's not that bad," or whatever. But
Yeah.
that is why I think it's really important to provide culturally humble care, which is to understand more about a culture. I don't think we can ever be culturally competent. I don't think I could ever say that I'm competent in indigenous
Mm.
culture, but I could be humble to understand the
Mm.
ways in which their culture influences or
Yeah.
impacts their life and how they interface with the healthcare system. So if we know this about Black women, then we know to listen and have a more attuned
Yeah.
ear
Yeah.
the way they might be presenting and understanding and potentially preventing a preterm birth. She might just say, my back has been bothering me a little bit. But instead of us just saying, well, you're
Yeah.
pregnant and you're
Yeah.
going to have lower
Right.
back pain. Lower back pain can be indicative of preterm
Mm.
labor.
Huh.
So listening and taking a more thorough
Interesting.
history, right, to really understand what's going on with the individual.
Yeah.
And so we're talking so much about, having a baby, and our culture celebrates the having a
Mm.
baby showers, gender reveal parties, all of it. And then you have the baby and it's like
You're on your
crickets.
own.
This poor mom and a baby, and
Figure
they're like,
out how to
motherhood,
feed it,
I
how
don't
to
care.
make
Yeah.
money to take care of it. Just go ahead, figure it out.
It doesn't matter where
Yeah.
you are in your life, having a baby is hard. And so just talking about postpartum and your experience, I guess maybe one thing is to separate a little bit like the real signs of postpartum versus like what's more common and like baby blues. Like, when should family members start to worry about this mother, or the mother, herself be like, I need to reach out to someone? Like, at what point do you actually call, I have an issue?
Yeah, I have a physician colleague at UNC who, Dr. Allison Stubbe, and she gives this analogy of a Reese's peanut butter cup, and the Reese's peanut butter cup, like the candy on the inside, is like the baby, and then the wrapper
Mhm.
is the mom, and then once we have the baby, we just throw the wrapper away, right? Like
Yeah.
we get to the candy, we get to that piece, and then we just throw the wrapper away, and the moms are discarded. We forget
Yeah.
about them, and so it is important to recognize that you know, back in 2003, I think you said when you had a child and were uh, possibly in a postpartum depression, we would have just said maybe, "Oh, you have the blues, you got the baby blues," right? We talk about postpartum blues, which typically can happen during the first couple of weeks. But after that first couple of weeks, if you're having trouble sleeping, if you're having trouble taking care of yourself, taking care of the baby, crying for 24 hours or longer, that's when we start to get more concerned. And when I say, let's go ahead and have you contact your healthcare provider.
Hmm.
I think for family members noticing changes in eating, not eating a lot, changes in sleeping. Now, changes in sleep and eating happen anyway after baby,
Sure.
right? But if we're noticing sleeping for longer periods of time than you would think would be normal for having had the baby, or not sleeping enough, or rage, or um, postpartum OCD also can happen where
Mm.
they really ruminate and perseverate about what's going on with the baby, the baby, the baby, the baby. They're really focused on maybe diaper changes or whatever. So paying attention to that as well is really important. And then obviously any type of ideation regarding self-harm or wanting to harm the baby, that's an emergency, and wanting to involve, like calling 911 so that we can get care. But there is also a suicide hotline, 988. I think it's 988 is the number that you can call if you're having thoughts of wanting to hurt yourself. Postpartum Support International, an amazing resource
Okay.
for postpartum moms, and they have a hotline as well, that can be helpful for moms who are dealing with maternal mental health concerns, and they also have a hotline in Spanish. So, that's an amazing resource as well. Um, but really wanting to pay attention to self-isolation. If you find, because it's not uncommon that moms want kind of maybe quiet, they're in their bedroom or, with baby, but if they're not wanting to do the things that used to bring them joy, not engaging with family members the way you would expect them to, those are things that can also be quite concerning as
Mm.
well.
Yeah.
Yeah,
It's
it's a
it's
lot.
very
Having a
very
Yeah.
baby is hard.
well, and I think it's also difficult because I mean I've had 3 babies, so I kind of it's been a while, but I think when you're at that point, like these symptoms that you're mentioning, I think there's it kind of ties back to also worrying that if you do let people know that they'll take your baby away, right? Like if they think that you're incompetent or something like that. So I think again it's like very easy for the women to sort of push it down and not reveal it to other people for those kind of fears, right?
Mhm.
It's very complicated. So your work is very, very important. And I love
Thank you.
if we go back to the idea of training medical personnel on culture differences, so important. Um, is there any movement or are you working on anything that will kind of like be able to deliver that more across the state, the nation?
Yeah, I've worked with a large university in the north, on developing modules for residents,
Mm,
in what we call reproductive psychiatry,
mm,
which includes perinatal mental health. And I was helpful in developing the module on providing culturally humble
mm,
care to Black perinatal
mm,
people. And so the idea is that they will have these modules that are going to be mandatory for the residents to
mm,
take, which have little quizzes at the end for them. And then the idea is that hopefully it would be part of their creogs or their boards,
mm.
so
Yes.
that it's required that they get this type of learning, this type of teaching, this type of
Yeah.
immersive
Yeah.
conversation, which I realize is not, warm and fuzzy conversation, but it's conversation that needs to be had
Yeah.
nonetheless, right? And so I think it's really important for folks to be able to sit with some discomfort, um,
Yep.
and especially do their own work in the learning, right? Not always having to be spoon-fed and things, but actually spending the time to read books like Medical Apartheid, to read books like Henrietta
Mm.
Lacks, like, to really spend some time steeping themselves in the work that has already been done, that's already there. There's also the Seleni Institute that, does, work with maternal mental health as well. So there are resources
Yeah.
out there, we just have to get the word out, and this is why I do podcasts, and this is why I do speaking engagements, around the country, to be able to get the word out there and to be able to elevate this conversation and normalize the
Yes.
conversation so we're not uncomfortable,
Yeah.
Yes.
right?
So, what do you wish every new parent heard before they gave birth?
I've said this before, but really just wanting them to know that they're not alone. I think a lot of
Yeah.
times they can feel very isolated and be like, I'm the only one that has these types of feelings or intrusive
Right.
thoughts or,
Yeah.
whatever it may be. And you're not.
Mm.
And some amount of intrusive thoughts we just people
Yeah.
have. People have them, right? And so it's just whether or not you're going to act on it. Many
Mhm.
people will have these intrusive thoughts that they find disturbing. If you find it disturbing, that's a good
Yeah.
thing,
Interesting.
Okay.
right? Because
Yeah.
more than likely you are not going to
Yeah.
act on it. It's if you don't find it disturbing, you may act on it.
Mm.
So wanting new parents to know that they're not alone and that there are resources out there to help them with their mental health. We know that 20% of individuals will develop postpartum
Mm.
depression and postpartum anxiety. That statistic may be a little bit higher. We just don't study it as much. But we know that it is quite prevalent. So if you think about 1 in 5 or 20% of women will develop a maternal mental health condition, that's significant.
Yeah.
And we need to spend some time shining a lens on it so that we can, as I keep saying, normalizing the conversation. And I think we've, again, people in mainstream media, not necessarily pregnant, but like Naomi Osaka and Simone Biles talking about their own mental health concerns with
Yeah.
anxiety and stuff. It's helping to
Yes.
elevate
Yeah.
so that folks see, oh, other folks who seem to have it all together, don't have it all
Yeah.
together.
Yeah.
I would argue none of us have it all together.
I would agree. I have not met the
Ah,
person
yeah.
yet.
Well, and I think also having providers that look like you and share
Yeah.
your background, which kind of goes back and I wonder too, not to open a huge can of worms, but the recent since abortion, the ramifications when abortion was, you know, made illegal in many states. How is that affecting provider training? Are we having less OBs and OB-GYNs? How does that affect maternal care?
Well, I think we know that it's impacting it negatively, right? So we've already heard.
It's understatement,
Yeah,
right?
we've already know about and heard about individuals who've passed away because they could not get
Yeah.
access to services, right, to abortion services. And um without making this anything political, if you have a person who is pregnant and has a non-viable fetus inside their uterus and we don't take it out, it is a risk for infection if she's not able to
Absolutely.
pass it on her
Yeah.
own, right? So not providing access to abortion services to in that case to me is egregious. And I also will just say the views that I'm saying are the views of Dr. Sheffield Abdullah, not the views of the University of North
I
Carolina at
understand.
Chapel Hill.
Sure.
So let me just say that
Yeah.
qualifier. I do not think that we should be picking and choosing who we think gets access and who doesn't get access, and for what reasons they get access or not. Right? So even in me giving that example of, oh, somebody who's had a miscarriage but hasn't expelled the contents or the products of conception, needs to get access to that. Even an individual who wants to terminate their pregnancy because that's what's best for them, they should also have that access. So I do feel strongly about
I agree.
that. Um, and so what's happening in terms of legislation and all the changes, I think as we will, in hindsight, look back at this time and look at statistics and look at what's happened, we're going to see that there was a spike and increase in maternal mortality.
Yeah.
That there are women who are absolutely dying because they do not have access to this care, or they cannot afford to travel across state lines to get access to the care in places where it's still
Yeah.
offered. So I don't think we're going to have less OBGYNs or less midwives.
You don't think it's pushing people out of studying, going for a certain specialty?
Um, I don't know that it's pushing them out of studying a certain specialty, but I do think they're definitely thinking about where they're going to practice. I have talked to my OBGYN
Okay.
colleagues who are like thinking about moving from the state that they're in to a state that does allow it. You know what I mean? I know somebody who
Yeah.
actually did just move. They said, "I can't be in such a conservative state. I have to be somewhere where I can
Yeah.
provide this service." So I think we're gonna see more people being in places that align with their core
Yeah.
values.
Yeah.
And that'll affect medical care for everyone who lives
Absolutely.
there, you know?
Yeah, yeah, I try to stay as somebody who has anxiety, or as I like to say, as a person who copes with the symptoms of anxiety so that I'm not the label, right? So the person is, "Oh, that
Yeah.
person is depressed." No, they're a person coping with the symptoms of
Yeah.
depression, right?
Mm.
So as a person who is coping with the symptoms of anxiety, I do worry about what is gonna happen long term as a function of all the changes that we are going through. It's like drinking through a fire hose every day,
Yeah.
to digest all of the changes that are happening. But certainly within maternal infant health, there's a lot of changes. I mean, if we just think about vaccines, we have our first case of measles here in the county that I'm in. Who would have thought that we'd be seeing measles? You know what I mean? Like
Yeah.
in this day and age. So really, I think it'll be many, many years for us to be looking at the consequences of the changes that are being made
Yeah.
currently.
I agree. It's an interesting time to be alive. Interesting is the best word I can find for it.
I wanna go back to precedented times.
Me too.
I just want precedented. I just want, just easy
Yeah,
peasy
we've
peasy.
seen this before.
Precedent.
We know what to do.
Jokingly, but in all honesty, I do not believe that our nervous systems were set up to cope with the cumulative chronic toxic stress that we are experiencing over a long period of
Yeah,
time. And just before getting on the podcast, I was reading about high functioning
yeah,
burnout. Um,
Mm.
just you're especially for high achievers like myself, I'll just speak on in my own
yeah,
experience. I can still be doing all the things, right? But what is the conversation playing in my
yeah,
head, right? So I can still be high achieving, doing all the things, but at the same time, with the way that the world is in today's day and age, especially with social media, I do want to make myself aware of what's happening, but then you can go to a place where it's too much, right? And it's
yeah,
overwhelming and that now it's kind of hijacked your day. So really
yeah,
encouraging our moms, especially our pregnant individuals, to really protect yourself, protect your peace, do what it is that you need to do in order to decrease your stress as much as
yeah,
possible, decrease your anxiety as much as possible, decrease depressive symptoms as much as possible, and really thinking about what are the coping strategies that you have for your own mental health.
yeah.
Yeah.
Right. And thinking about it, ideally, you're thinking about it before even getting
Mm,
pregnant,
interesting.
right?
Yeah,
So if we could do this preconceptually, that would be fantastic. But even once you are pregnant, being very intentional,
yeah,
it's slowing down. and
Mhm.
taking time to prioritize your own mental health. We cannot have physical health without mental health. And that's a quote by Dr. David Satcher, former US Surgeon General. They are inextricably connected, mental
Yeah.
health and physical
Yeah.
health. And so we tend to focus more on physical health, but I am really encouraging and the ask is from me for us to be able to prioritize our mental
Mm.
health. Because I'm really interested with all of that has happened, with organizations being dismantled or dissolved or gutted, however we want to talk about that. I'm really interested in seeing how are we going to be capturing what's happening regarding maternal mental health during this time,
Yeah.
because the traditional places like the CDC aren't necessarily in that work,
Yeah.
right? And I used to be on the North Carolina Maternal Mortality Review Committee. Those committees are across the country. Different states have them, but we review all of the deaths that have happened in a state. And a lot of times we are able to see whether or not there were mental health concerns during that pregnancy, labor, and birth. And so wondering how we're going to be capturing all of this data to be able to for me to continue to be able to give you
Yeah.
statistics on things,
Yeah.
right? Yeah.
Yeah.
So, super
Well,
important.
the work that you're doing, sharing the resources so that moms, women and moms, especially new moms, know that there is help out there.
There is.
And there are things that you can do, but also, working on these systemic changes, like going after what are the possible genes to identify if you're at a higher risk for postpartum depression.
Mhm.
Like that's such important work. And thank you. Thank you for
Yes.
being
Thank
on
you.
here and thank you for sharing this.
Yeah.
Thank you, Kath and Lisa. I really appreciate the opportunity to speak so honestly and candidly with you about this critically important public health concern, and the importance of elevating this conversation anywhere and everywhere that I can. So thank you
Yeah.
again.
Thank you. Thank you for your work.
But
Before we
before
let
we
you
let you
go,
go,
so Dr. Karen, what does the matriarchy mean to you?
So the first thing that comes to mind is the matriarchy to me means the revolution.
Hmm.
Like, I think it's within us as women, and certainly speaking as a Black woman, revolutionizing what it is that I come into contact with
Hmm.
Hmm.
and being seen as a person that will speak truth to power. And despite what the consequences may be, really being true to myself ethically, morally, and my core values. And I think women
Hmm.
have that innately. And I think within if we think about within a matrilineal kind of society, what we could accomplish, what could be done, right, with us at the head of things, I think could be revolutionary. So that's what I'm hoping is going to come from all of what we're seeing at this time from the
Yeah,
patriarchy. Let's think about the
that's right.
matriarchy.
Yes. Thank you.
So I love that.
Yes, exactly. I agree. I want to believe that all this is happening to make room for a better society, predominantly led by women.
Well, I could talk to
I
you
know.
all day, but I wanted to be respectful of your time and the work that you're
Yeah.
actually doing to
Yeah.
make it better.
Well, thank you. Yeah.
It was truly a pleasure to speak to you. Thank you.
Thank you. Bye.
Another impressive
I
woman.
know. That I am so grateful that her team reached out to us because, as you
Yeah,
mentioned, we'd been wanting to talk about this for a while, and just, it was just really, really impressive and informative, and just such an important topic, which we just don't look at enough. And
yeah.
I think hopefully this will create more conversations with people after they hear it and to talk to their friends and their circles about these issues because I'm done having kids. I remember those days,
Yeah.
but mothers need the extra help all the time, and
Yeah.
maternal health outcomes, especially in the Black community,
And the intersection of it is just, we don't talk about it
we
enough.
don't. We don't talk about what it's like to be a woman in this society enough, let alone a woman of color, right? And what that
Yeah.
means through the whole female cycle, you know?
I remember when my oldest was an infant and I went to the grocery store and it was after all the help was gone, right? Like my mom was with me for a while, then she left and it was just me and my cute little baby. And this woman stopped me and she was like, "Oh, your baby's so cute. And how old?" And he was just a few weeks. And then she stopped and she looked me in the eye and said, "And how are you?
Mm.
How are you holding up, Mom?" And I remember that to this day because I'm like, no one
No,
asked me that.
exactly.
Maybe like a close friend or my mom, but like the general public, they're about the baby. And I mean, I love babies. That's why I have four of them.
Of course, yeah,
But it stuck with me, and I really appreciated
yeah,
her just even that simple
yeah.
check-in.
Just to be acknowledged in that way
I
as a
should do that
human
more.
being, as a person who's gone through something pretty
Yeah,
big. I mean, having a baby, well, first of all, I don't feel like I was prepared for what it was actually gonna be like. Like, no one teaches you
yeah,
what the whole process was gonna be like, the birthing process. And then you just, kicked out of the hospital after a day, like, okay, go home and take care. And it's hard. It is really hard. And we didn't touch
yeah,
on this, but something that I think about a lot is, and Kathy, you and I have talked about this a little bit, about how our society is set up so that we just go home to this house that's away from everybody else. And I
yeah,
think, in previous times in human history, that wasn't necessarily the case, right? There would be much
yeah.
more community around
Like a
and a lot more,
support
like
group.
just natural support. So, like when we were talking about the idea of recognizing symptoms, I was kind of imagining what it would have been like in a different time or in a different space than where we live, where you have more community, so that it was almost like other people would notice if, like, I was just imagining, like, in my situation, if that
Yeah.
was me. I honestly, I don't, did not experience extreme depression like that, but if that was me, would anybody have noticed? Like, my husband's off
Well,
to
yeah, and
work
you wonder.
and, no one's coming in. It's just me and the baby. So, yeah.
I moved with the birth of my first and second
Yeah.
babies, so we moved to somewhere we didn't know
Yeah.
anyone. And so I hooked on right away to play
Yeah.
groups, like this. The first one was actually through the hospital.
Okay.
It was like
Yeah.
this mom support group, and I didn't know what I was going to find, but I found actually some of my still
That's
closest
nice.
friends. And I'm an extrovert mostly, right? So I do go to these things, and then I made a point of meeting up with these moms and still friends, and it was still
Yeah.
hard. And I relied on these other women who were the exact same stage of motherhood because that's how we found each
Yeah.
other. And it, like to your point, it was not
Yeah.
organic. It
You
was
had to
like
work
a
on it. Yeah.
program that I
Yeah.
found. Yeah. It, I mean, I have the family helps and stuff, but yeah, you're on your own. And thank God for my mom friends,
Yeah.
honestly. Like
Yeah, I eventually did.
that
I
would
think
have
my
been really
first
hard.
was, a year, almost a year, and like 9 months before I found a mom's group. But
Yeah.
to your point though, all those women are in the same position as you. Much later, when my kids were older, someone brought up the point that when they first had their child, one of their friends came over with a vacuum cleaner and cleaning and was like, "Listen, I'm gonna clean your house for you." Like, you know what I mean? Like, and I was like, "Oh my gosh, could you imagine like if somebody just showed up and helped in that capacity?" Like, and so I think about, I mean, I think about that a lot. I don't I don't have people in my life having babies right now, but I'm sure once my kids
Yeah.
start, I
But you
will.
will
Like, I want to
once.
be that grandma, right? Like,
Yeah,
sure,
yeah,
I'm going to want to play with my grandkids, but I'm also going to clean the house for you. Like, I'm going to do this
yeah,
for you.
yeah.
But I just keep thinking that in a different setup, like a different community setup, a different way of living, that would be a natural part of the community is that
Mm.
sort of support
You mean
systems.
maybe in a
Like maybe
matriarchy?
in a matriarchy.
And I tell you, I do want to give a shout out to Brooke Shields. Brooke Shields, if you're listening, because it was 2 years, my oldest was 2, and she went and talked about her postpartum, and then Tom Cruise, who
Oh,
like
I kind of
a
remember this.
man,
Yeah.
right? Scientology. Do you
Yeah.
remember this? It was a
Yeah.
big thing,
Yeah.
and so I kind of refreshed my
Mhm.
memory in
Hmm.
preparation for this. She took out an op-ed in the New York
Oh, I didn't know.
Times. He
Yeah.
Yeah, and, she was basically like, "Look, this is the way it is," and she said having a baby made her be able to use her voice, or else she might have just
Mm,
been like, "Whatever," but it became this big story, and Tom Cruise eventually
mm,
apologized, and she said she took it, in the vein in which it was accept but it brought this conversation because back then, this is like, what, 22,
yeah.
3 years ago? We weren't talking about mental health. Hardly, let alone postpartum
For sure.
depression. And so having these, like, just knowing that that's a real
Yeah.
thing and that even if you're not going to like psychosis levels, hopefully, right? Like these are horrible things and you're isolated, it makes it worse. But after you have a baby, you do get the blues.
Oh,
Like
for
it's hard. Your
sure.
life
Oh, for
changes, whether
sure.
it's your first or your fourth, you
Yeah,
know?
for sure. And yeah. And like for me, after my second baby, I did like some of those symptoms she was saying, like, oh, did have some of those. It ended up being that my thyroid had decided to cash out. So there was like
Mm.
another thing. But that's also an important thing to recognize is that, if you're having these symptoms of any sort, like, you know, it is a good idea to tell someone and get a doctor's opinion on it. Because I could have just written that off as just postpartum depression, but there was actually something
Yeah.
else that
Yeah.
happened, right? And so medication was a godsend. It was amazing. It made my life so
Yeah.
much better. So yes, like I think women, and I think what she also brought up about women, Black women specifically downplaying their issues because of cultural factors. But I think all women, or many women, not I don't want to say all women, but
I
many women
agree
do.
with
I
that.
understand that. I don't want to discount what she brought up because I do understand. I do understand that Black women have a
It's
specific,
like
yeah.
there's just
But
yes.
many
Yeah.
women tend to do this. We tend to just keep trying to caretake, and then we don't take care of ourselves. So that's my
Yes.
encouragement. Is um,
I remember one time I was talking to my mom, she's like, "Oh, my glasses aren't quite right." And I'm like, "Well, when you did the test, it's not a test. It's like, can you read those numbers?" And she's like, "Well, can I do it?" And I squint and I'm like, "Mom, like you're here to
that's
make
a
it
great
easier,
example.
not to prove to some doctor that you can read it." Like
Well, but
and she was
that
like,
is
"Oh,
it. Like, we
yeah.
don't wanna, like I mean, maybe it's the fear of
I don't want to be
criticism. We don't want
an inconvenience."
a little bit of
Yeah.
everything. We don't wanna be an inconvenience. We don't wanna be criticized. We don't wanna feel less than.
We don't want
We
to
don't
be
wanna be
weak. We don't
weak,
want to feel
right?
weak.
Like, there's, like, all
Yeah.
these pieces to that, and it is cultural.
Yeah.
So this is a great discussion and just a reminder to get women
And
to, take care of themselves and take care of each other.
to take
So,
care of
yeah.
themselves, and she's a mindfulness coach, and you can see that in how she
Yeah.
talks, and one other thing that, like, I learned about what in the work that she's doing that, we just didn't have time to talk about, but, we have all these checkups for babies,
Yeah.
and, the
Yeah.
mom,
You're
you'll have your
done.
6 weeks checkup, but then you're pretty much done. Maybe you'll get a call or 2 from the hospital,
Eh.
right? Like, how's the
Yeah,
nursing going? If you're
maybe.
nursing, whatever.
Maybe for the first
Um,
one.
but, like, maybe Um, but having those checkups on for the mother, right? Not to put like the mom has to go to the doctor and find healthcare, but like as a pediatrician or a family doctor to be like, how's the baby and how are you,
Mhm.
mom? You know, like let's check it, like having some, like if we could create more natural points of
Mhm.
contact with
Mhm.
care,
Mhm.
that we check in on how the mom's doing. And yeah, I mean, we're gonna change society overnight.
But that's,
Or we can
that's what these
support our
conversations, I think, I do believe that through conversations that grow into other conversations that eventually grow into policy or programs, I think that is how we change. And it does start with conversations. So that's why I'm so grateful that Dr. Karen joined us today and shared what she knows.
yeah.
So,
Well, thank you for our audience for again being with us today. We do value your time, and we hope you enjoyed this episode and that you got something out of it because I sure
I
did.
did too, a lot.
Yeah.
Well, thank you so
Mm.
much. I know we always ask the same things. But
Yeah.
broken record still means a lot. I think we're focusing right now. If you are on Spotify or Apple Podcasts, if you wouldn't mind giving us a 5-star rating, like that's gonna increase our reach, and we really appreciate it. So, welcome to the matriarchy.
Welcome to our community.